I primarily do robotic surgery here. I think I'm the only person in Central Alabama who does robotic surgery for the prostate, as well as the kidneys and other urologic organs. What I think is really the main advantage is that, one, we have 3D visualization into a high definition screen. So I'm seeing it just like you're seeing on the best television screen that you could possibly find. I'm able to see the entire internal anatomy using that same technology. We can magnify the view so I can see it a lot better as compared to the old traditional version where I would stand above the patient and try to look down into the pelvis. The prostate lies deep into the pelvis, and it can be very difficult to visualize all the structures that you're trying to preserve as well as the ones that you're trying to get out. We have better preservation of the nerves, and that's because of the finer dissection that we have, the ability to see, improved return to continence, and then blood loss. And I think blood loss actually has a lot to do with some of these other things, some of the improvements, and that's because in the old-fashioned version of the surgery, people would lose up to a liter of blood, 900 cc's in the operation. A lot of them would require blood transfusions. The average blood loss now is between 100 to 200 cc's. So most people don't need blood transfusions. You can imagine if there's blood going into the field and you're trying to do an operation, you're trying to spare this nerve tissue, that can be very difficult if your field is always being blurred by that. So the robot, because of its these other reasons, allows to have a lot less blood loss and then less morbidity. My patients typically go home the next day. So if I do a surgery today, which I did earlier today, I expect that my patient will usually go home around 9 or 10 o'clock in the morning after the surgery. That means they're up walking in the hallway, they're eating a regular diet, their pain is completely controlled with just some minimal oral pain medications. They've been taught everything, and I would say probably 95% of the patients who I operate on will go home the next day after surgery. This is what we do when we look through. So people say, what does it mean to do robotic surgery? Robotic surgery is essentially laparoscopic surgery. So most people know what that means. It's the small poke holes that go into the belly that allows us to work inside the belly. Well, the robot is the same exact thing, except in addition to those poke holes, we have an instrument that dock to a robotic arms. The surgeon actually sits at the console in the same room. We look through the 3D magnification, high definition screens, and all those arms with those poke holes are being controlled at the console by the surgeon. So it's a really, I think, a great advance in surgery, and it's allowed us to do so many great things in a minimally invasive way, which in the old days, patients would have to be in the hospital for several days. They'd have big incisions. They'd be very painful, lose a lot of blood. And I think that the robot has really changed our ability to do surgery effectively and with a lot better patient outcomes. So just kind of a little bit about the robot itself. The instruments and the manipulation of it were actually modeled after the human wrist. You actually have more degrees of freedom, meaning that more ability to turn and maneuver the instruments using the robot than I actually would have with my own physical hand, which is, again, very advantageous when you're doing surgery in a very fixed space like the pelvis. You can see how big the instruments are. That's a dime, and you can see the small, tiny instruments that we're using. So again, very, very precise dissection and ability to operate and do what we need to do. So in conclusion, all men, I think, should be educated. And I think that's step one of what you all are here for tonight is learning about prostate cancer, learning about the disease itself, the treatment, should you be screened and should you not be screened. Not all prostate cancers, again, are created the same. That's why if you get diagnosed with it, you need to talk to someone who knows, the broad picture of what's actually going on, what's going to happen with your quality of life, and if you choose X treatment as compared to Y treatment, what should you expect? I emphasized this earlier that all prostate cancer treatment should be with the aim of curing the cancer. As technology improves, we're getting a lot better outcomes than we used to do. So it's not, this is one of the areas in medicine that's really exciting, is that what we're able to do now based off of technology, and that includes robotic surgery, and even with radiation therapy, they're getting a lot more precise about being able to target just the prostate and spare some of that peripheral damage that happens when you radiate the outside of the prostate. Robotic surgery, as well as other minimally invasive surgeries, are now here in Montgomery. I think it's a huge advantage for patients and their families, that you don't have to drive to Birmingham, you don't have to drive to Atlanta, you don't have to drive to Mobile. You can get the same high-quality surgery done here in Montgomery that used to be require a lot of travel. Thank you. I'm located next door at the 502 suite in the Good building, and that's where we'll be doing the screening test tomorrow.